If you're planning on having hip replacement surgery or recently had one and are curious about what recovery typically looks like in the first 3 months after surgery, keep watching as I'm going to talk about from a physical therapist standpoint what most patients generally look like in their recovery after 3 months and what we want to focus on in terms of goals as you progress through this period. I'm Matt Sigwa, a doctor of physical therapy, and I've treated hundreds of patients who had hip replacement surgery. And in this video, I'm specifically going to discuss the symptoms, the function, and exercises that are often associated at the 3-month period after this procedure. With that being said, every patient does heal at different rates, so don't be worried or alarmed if you're presenting slightly different than some of the presentations that I'm about to discuss, or if the exercises seem a little bit too easy or too hard. These are just generalizations of what most people will experience based on a lot of the patients that I've worked with in the past. So with that being said, let's get into the video. So for your symptoms at 3 months post-surgery, when you're talking about swelling, essentially at 3 months, the swelling at that surgical leg from the hip all the way down to the toes should essentially be all gone and very symmetrical to the non-surgical leg. Now, for the individuals who have some remaining edema and swelling on that surgical limb, usually those patients are the one who tended to be a little bit more sedentary or had such significant pain pre-surgery that they weren't as active and weren't taking as many steps or just being very mobile prior to the surgery. And they'll have a little bit more retention of swelling even pre-surgery because they were more sedentary. So those are usually the individuals who will persist after or at the 3-month mark with some remaining swelling at that surgical limb. But for the most part, most people will have very minimal to no swelling at 3 months post-surgery. Now, when you're talking about pain symptoms, most people after having this type of surgery at 3 months, their pain is going to be significantly better, where it's usually 0 out of 10 having no pain at all to maybe like a 3 out of 10 where they're having minimal to very moderate type of hip pain. So essentially it's a big improvement regarding that type of discomfort that they're having at the 3-month mark. Now, it is still not uncommon to see some patients persisting with discomfort in the hip. Some of those cases will be at the extreme ranges of motion. So if a patient tried to squat down or bend down real low, like for example, past 70 degrees, close to that 90 degrees, they can have some pressure or even some tension in the hip that feels uncomfortable and gets worse the lower that they go. And then that could be one of those cases where the hip joint isn't ready for it. You can have a lot of tightness or stiffness in some of those soft tissues and the structures around the hip that still need to be worked on with physical therapy and mobility exercises. So those end ranges, whether you're going all the way bent at the hip or if you're really stretching it and getting that leg to go behind the body and stretching it that way. So those extreme ranges of motion or those really end ranges of motion at the 3-month mark, we're still being somewhat careful depending on how that patient is presenting with their symptoms. But usually the extreme ranges of motion, so excessive bending or extending at that hip joint, can be one of the common areas that people are still having discomfort at the hip. But for the most part, at 3 months, a lot of patients are having either no pain at all to like very minimal pain in the hip. So that 3 out of 10 on that pain scale. And in regards to bruising at the hip joint and at the lower leg, essentially at 3 months, they're pretty much all the way gone for most patients, unless you're the type that bruises easily and they last longer and you have maybe possible like iron deficiencies or just delayed healing when it comes to bruising, then most people will have essentially no bruising at 3 months. So for this time period, one of the most common questions that I get is, what am I going to be capable of doing? And will I need an assisted device, a walker or a cane still to get around my home or even in the community? Like what kind of assisted device will I need? And hopefully that I'm not even going to need one at that point. So in regarding the assisted device at 3 months, if this patient wasn't relying on an assisted device, so a walker or a cane, for stability and balance purposes, and they were mainly only using one just to offload the hip and reduce pain, then at 3 months, they're definitely no longer going to need an assisted device, because then the hip strength is going to be significantly better at 3 months. The balance is going to be better, but also just the weight bearing tolerance, so the amount of pressure you can put on the surgical limb, is going to be a lot better at 3 months. So really the only cases that I've seen where someone had a hip replacement and still needed maybe a cane at this time would be if they were a significant fall risk even before the surgery, which in that case most patients don't typically get a hip replacement if they were that much of a fall risk, unless the pain was super significant. But they'd have to be really reliant on an assisted device, and we're using that cane very long term, so multiple years. That's one of the cases that people may continue to have a cane at 3 months. Or if they had some sort of post-surgery complication, whether that be a DVT or they had a fall and had to have a revision, those kind of extreme cases. But in general, assuming that a person's had routine healing where there's no red flags, no DVT, no falls, no accidents, then at the 3 month mark, most patients will not need an assisted device, and that will be cleared by your physical therapist, assuming that you're able to weight bear appropriately. You have good symptoms, so no reactive pain or swelling when you're using no assisted device, and you just have overall good balance and stability without using a cane or walker. Now, regarding exercises at the 3 month mark, a lot of the exercises that have been completed and prescribed up to this point are very therapeutic in nature. So some of the things that have been worked on up to this point should have been gait training. So your therapist has worked on teaching you and retraining the proper mechanics of walking, and also trying to get you to relearn those movements without any compensations, and to the point where you're able to walk and perform the correct movements without an assistive device, so no cane, no walker. Also with exercise, they're going to be working on reducing a lot of the symptoms, right? So reducing the pain and reducing the any stiffness that may have been developed over this time period. So working on flexibility of muscles, working on soft tissue massage to also reduce some of these restrictions in the soft tissue that often happen after the surgery. Another thing that therapeutic exercise will focus on after this type of procedure is making sure that we turn on the correct muscles that have been affected, negatively affected by the procedure. So for example, your hip flexor, your quad muscles, if you had the anterior approach for the hip replacement, those muscles will essentially become dormant, and we have to make sure that we're able to not only turn them on, but isolate them with certain exercises, so that when we get to the point where we're doing compound movements such as a squat or even like stairs, we want to make sure that you're able to turn on each individual muscle. So in the long run, you don't get any compensation from other groups of muscles or other joints or the opposite limb overworking, and that can potentially lead to overuse injuries and other compensating type of injuries that are easily avoidable as long as we address them early in the recovery of this type of procedure. With that being said, that first 3 months, usually most patients, once they hit this mark, all the therapeutic exercise that they have been working on is going to be enough to allow them to return to their daily activities, all their ADLs. They're going to be able to perform stair ambulation, so going up and down stairs. They're going to be able to easily get in and out of their bed, in and out of their couch, in and out of a car. Those transfers are going to be a lot more manageable. And at this point, a lot of people who don't expect or plan on returning to some sort of recreational or sporting activity, this is where a lot of patients will stop their physical therapy, or at least stop focusing on more challenging exercises, and their work more on any lasting deficits, whether that be a little bit some limitations in range of motion. So if they're still lacking some hip extension, so bringing their leg behind their body, if they still have limited range of motion with that type of movement, then physical therapy will continue to work on some gentle stretching, some soft tissue to make sure that they're able to reach that range of motion, make sure that joint stiffness is reduced, and they're able to actually get all the tissues and the joints to actually move as they should, or they're working on making sure that your symmetry in left to right, so surgical and non-surgical leg, are relatively close in terms of strength. Now, for the individuals who do plan on returning to some sort of sport or recreational activity, 3 months is that general time that people will start to incorporate a lot more single leg activities, single leg strengthening, single leg balance movements, so they can specifically work on mimicking some of the movements that are required within their sport or recreational activity. Now, maybe at the 2 month mark, patients have been working on some single leg heel raises or some very low level lunges or alternating steps on the stairs. Those are often commonly done before 3 months, but usually at the 3 months, for the people who are trying to get back to sport, now the single leg exercises, essentially they just get more intense and they're progressed accordingly by the physical therapist. So to recap, essentially the 3 month period is where a lot of people tend to have reached their prior level of function in regards to their day-to-day activities. Pain-wise, mobility-wise, balance-wise, they're a lot closer to normal, where they're able to manage a lot of their exercises on their own, and they often get discharged by physical therapy. The ones who usually continue physical therapy are the ones who plan on returning to some sort of sport or recreational activity, or they just have a few more longer lasting limitations, so range of motion or still some strength and balance deficits. Those are the patients who continue to work more diligently with their physical therapist, but for the most part, a lot of people end up being discharged around that 3 month period as they're able to return to their daily activities. Now, if you had hip replacement surgery and you're past that 3 month mark, please leave a comment down below and maybe share your experience, so that gives a lot of other viewers who are watching this another insight, because then a lot of the experiences that I'm sharing are from my work with different types of hip replacement patients who had posterior, anterior approaches. And obviously this is from a PT standpoint. So if you want to share your story and agree or disagree in terms of how your experience has been, that'd be great, because then a lot of people will get to learn from your experience. So if you had surgery and don't mind sharing, please leave a comment down below, and we'll see you in the next video.